Yes, very warm welcome to yet another talk. And I just want to make this video before I return home from the hospital. It's been a very hectic day today, but yeah, that's the service we give to this community. Now let's understand the sudden rise of type 2 diabetes in children. I'm not going to speak about a specific geographical position of the world, not like Uganda, Africa, or the Western world, the United States, the United Kingdom, but this is going to be a very broader perspective. I'm going to look at it in a very broad perspective. So the global surge in the type 2 diabetes in children and adolescents really demands our first actions. And when you look at one of the contributing factors, the biggest contributing factors to this, regardless of geographical position, is the childhood onset of obesity in the different parts of the world, which has emerged as a very big public healthcare challenge across the globe, fueled by both genetic and epigenetic predispositions. But it's more so the epigenetic factors, which is more of the environment and your behavior generally. That's why when you set back to this community, it's a refugee hosting community in northern Uganda. And when you take a child from this community and you take the total prevalence of type 2 diabetes in this community, me personally, you can trust me there. I sit in the NCD clinics every week, but the cases of type 2 diabetes in children is really so much rare. It's not so much common. But if you read so much journals in the different newspapers and the different health media platforms, you find cases are being reported so much in the United States and more so the Western world, children suffering from type 2 diabetes, which is typically really so much preventable. But it also depends on the environment where a child lives in. You find this time there are a lot of factors which can result into childhood obesity. Just like I've said in Africa, like more so in the community where I stay in northern Uganda, trust me, it's not so much a big issue. Type 2 diabetes in children is really not so much. But type 1 diabetes, there are some few cases of it. Yeah, that one, trust me there. So there has been an exponential rise in the incidence of type 2 diabetes mellitus in children and in adolescents. That one everyone can prove. And this is gonna strain the healthcare budgets across the world and more so in the underdeveloped countries like here in Uganda, because the treatment of supportive care for these diabetic patients is really so much expensive, and this is a very marginalized community. So we need to focus more on the prevention part and dealing with these issues and speaking about it, so that we get into these cases rightly. And then you find a very collective global effort to curb the devastation caused by this situation is really highly recommended per now. And we need a very multifaceted research effort, governmental legislations, and effective social actions are crucial in attaining that we beat out type 2 diabetes in children in every part of the world, not only in this local community, but also children in the United States, children in the Western world, in UK, in Sweden, in Switzerland, any part of the world, because type 2 diabetes is really so much preventable. Now let's look into this paper. It is the World Journal of Diabetes, which is on 24th May, and it's a very trustworthy platform where you can get information from. Now it talk about the rising tide, the global surge of type 2 diabetes in children and adolescents, how it demands action now. So from this paper, it also confirms that childhood obesity is one of the biggest contributing factors to type 2 diabetes in children, and we have explained that it is more so because of both genetic and epigenetic predispositions, more so behavior. And we have said more light that there is a very big difference between this in the local communities in Africa and also in the much developed parts of the world. And this paper says that the consumption of a diet rich in highly processed foods, high in fats and carbohydrate contents with a very high glycemic index is likely to lead to both obesity and type 2 diabetes in children. This one, we can all confirm that in cases of this is more so in our diets, and we have seen reports that in the countries like the United States and where children are being served lunch which is really so much made of processed foods, and it's really so much disturbing to me to speak about that, because we are just killing the young generation. Processed food, more so the ultra processed foods, coupled with a lot of toxic chemicals, too much sugar, and also because we're not feeding into the generation, we're not doing anything to see that we have a very prosperous generation. Instead, we are killing the generation. The moment you take charge, you don't take charge and you give a lot of unrecommended food to your son, to your daughter to take to school, or you allow them to be fed such feeds. It's really not so much. You are not doing right. And you find the adoption of fast food culture in many developed countries, just like I've said, this is more common in the developed parts of the world, because in Africa, according to my practice and experience, because I stay in this community, it's very expensive to afford these highly processed foods, snacks, perhaps seed oils, McDonald's. We don't have McDonald's in this community. A lot of fast foods we don't have. It can be there, but it's really so much expensive. Even if maybe a family is to afford for a child, maybe once in a year, once in a month, so it's not going to pose a very big threat to the health of a child in this community. That's why the cases of obesity is really not so much. Obesity caused by more so the environment, the epigenetic factors more so. But this can be very common in the developed countries, more so in Europe, in the United States, because at least the economic standards there is so high, and you find a parent can be able to afford these fast foods on a daily basis for the child. Sweets, very sugary foods, it can be afforded, yeah, because the economic standard is also fairly okay. So that's why it is really so much common. And then so we talk about the invention of television and computers in the last decades. It has also resulted to this obesity pandemic. This is explained in a way that physical activity and being more active during the day is not so much common in the much developed countries, the Western world. This one, every parent can testify. You find every child sits in the coffers and on the phones watching television. They are really so much less active. Not like in Africa, whereby in the villages, the kids over 6 years old can at least dig, go to the garden, walk around, play a lot. At least cases of obesity and type 2 diabetes, that's why it's not really so much common in this community. Because of these factors, sedentary lifestyle is really so much cut in this community. So this paper continues to say that still obesity is a significant contributor to this. It's a core tip here, and the particularly concerning outcome of childhood obesity is in the early onset type 2 diabetes in children. So again, physical inactivity and overconsumption of energy dense, highly processed diets and various other unfavorable circumstances, including stress, inadequate sleep, adverse childhood experiences, and social determinants of poor health. Yeah, this is where the small cases of type 2 diabetes, the reason as to why it can be there in these African communities, more so in Uganda. I'm speaking in the community where I come from, refugee hosting community in northern Uganda. Yeah, stress factors. Yeah, because these are the contributors to poor health in this community. More so because of the economics standard. Many homes are really so much disadvantaged, and also children only maybe perhaps they have one meal a day, which is not really a balanced diet, and they really fast a lot. I think that also explains why it is a coincidental, because more so insulin resistant, when you talk about insulin resistant than intermittent fasting, you find a child eats maybe after 10 hours or 8 hours, wakes up in the morning, goes to school, no breakfast, perhaps no lunch, then comes back in the evening. That's when he takes the first meal of the day. I think that's a very pretty much time for cutting fats, calories, what we call intermittent fasting, and also it's a way of regulating the insulin and also fighting insulin resistance. I think that's also partly explains why the cases of type 2 diabetes is really not so much. But in the other way, also stress, because of the poverty levels and the hard lives, it can also result into what we call the stress, hyperglycemia, and possibly also more cases of type 2 diabetes can be in these communities. There are social determinants of poor health, and the paper continues to say that childhood obesity figures are also expected to double by 2035, with the figures in 2020 to about 208 million in boys. That's about 100% rise, and 175 million girls, about 1 to 5% increase in cases of type 2 diabetes and obesity in children and adolescents. So that's why we are talking about this, so that you go back home and you talk to your children, regardless of where you come from, in the United States, in the UK, at least form a very healthy routine, lives of parts of life, lifestyle modification. It's tool training that you talk to these children, and it can easily be adopted, and we are going to have a very healthy lifestyles, and we see health in every child, and I always say that every child should grow into healthy adults, and to realize their purpose in life, and also live a very equitable, happier life with the parents also. So again, another paper, it's a magazine, No Label. It talks about understanding the silent rise of type 2 diabetes in children. And more so, let's talk about insulin resistance, which has really so much resulted into this type 2 diabetes in children. So you find type 2 diabetes, the body struggles to use insulin effectively. The vital hormone, which is produced by the beta cells of the pancreas, it helps in glucose regulation in the blood cells, also in the cells of the body. And you find in the past, type 2 diabetes typically didn't arise until well into adulthood. That's where the biggest onset starts from, when you are an adult. But it's now different from now in the current world, whereby a child also develops these cases. That's why we are now talking about it. So this paper talks about cases in the United States youths aged 10 to 19 are rising fast. The cases are rising so fast, cases of type 2 diabetes. Since 2002 to 2003, the overall diagnosis has doubled, with 9 to per 1,000 youths to a very large number of youths in the United States really getting so much problems with this. And also the paper confirms that obesity still remains a contributing factor, and slightly more than 1/4 of the youths are obese, and this high percentage has really contributed so much into these cases here. So we need to take a lot of charge and also improve the health of everyone by having a very collaborative system of working together to see how we can put all this into hold, and we make a world which is really so much healthy through works of the government, policies, legislations, health policies which will impact the world. It must be right for once, so that we emerge a healthy generation all over the world. So let's take charge, and we work on this. Physical exercise, talk to the kids, exercising daily, eating well, healthy food, balanced diets. I think that's where we can have a very healthy generation ahead. That's where I'll stop, and we can meet in the next videos. Thanks so much, and a good evening. Let me also go back. Thanks.